everyone. We'll call our meeting to order. The first item we have is bill introductions. Senator McGinn.
Thank you, Mr. Chairman. I have a bill introduction, and it is RS 2710, and it concerns Kansas Open Records Act.
Do I have a motion? Motion by Senator McGinn, second by Senator Clays. Any discussion? All in favor? Aye. Opposed? Motion carries. Okay, next thing we have is we're going to have a briefing on the 2021 Legislative Post Audit. Chris Clark, Legislative Post Auditor. Welcome to committee, Chris.
Thank you, Mr. Chairman. Just for a moment of introduction, I am the new Director of Legislative Post Audit. I've had my post for a month, so I'm familiar with many of you. I'm replacing Justin Stowe. You may have been familiar with Justin. He moved on to the state of Washington. So I am here to go over just a high-level summary of all of the audits that my staff completed in 2021, and we're going to touch on one that was just released a week or two ago in 2022. Just a reminder, Post Audit is your audit staff. We work at the direction of the Legislative Post Audit Committee, but we conduct audits that legislators request. So I'm going to put in a plug. If anyone has any concerns over state operations, or your constituents are raising issues or that sort of thing, please reach out to myself or my staff, and we can put together an audit proposal to do some audit work. So with that, these are, again, a high-level summary of what was completed in 2021. First up is the one I mentioned we released a week or two ago. It was a study of taxation and exemption issues. And this was sort of getting at government competing with government and nonprofits competing with for-profit businesses. Although it appears that those entities may compete, the research indicates that true competition may be limited at best. This is because different types of businesses that may appear similar actually offer different services. Determining what industries and in what circumstances government, for-profit, and nonprofit businesses actually compete is a task that required, unfortunately, more time and more data than was available in this audit. And while government and nonprofit tax and exemption status might offer an advantage over for-profit businesses, such as property tax exemptions, sales tax exemptions, income tax exemptions, that sort of thing, the issue hasn't been well studied. And the existing tax data in Kansas was not precise enough for us to reliably quantify any specific effects of those differences. Next up, school districts' self-reported IT security practices and resources. This was what we call a limited scope audit. That's what LS stands for. That means it's completed within 100 hours. So these are very quick looks at what's going on. This was based on a survey. We surveyed all school districts across the state about their IT security practices. School districts maintain sensitive data, but Kansas districts are not required to implement any specific IT controls. State laws require state agencies to adopt certain IT security controls, but those laws don't apply to school districts. So we surveyed them all, and based on what they reported to us, many school districts have not implemented several basic IT security controls. For example, 58% did not require security awareness training for their staff. 59% did not require confidential data be encrypted when they sent it outside the district network. 65% did not scan their systems for vulnerabilities. 28% had no antivirus software installed. Districts reported to us that staffing issues and a lack of knowledge about what IT security controls to implement were significant barriers to improving their IT security. Next, back in August, we released the second audit related to the Kansas Department of Labor response to the COVID-19 unemployment claims surge. This was a two-part audit. I'll focus mostly on this part 2, which came out in August. In 2020, the federal government created several temporary unemployment programs to help individuals who lost their jobs due to COVID-19. There was a surge in claims There were significant delays for the Department of Labor processing those claims. One of the issues was the implementation and computer system issues. Department of Labor at the time relied on an outdated, piecemeal, and poorly maintained unemployment computer system. The system was created in the 70s and centered around a mainframe computer. Over the years, since the 70s, the Department of Labor has added programs to the mainframe, but created a piecemeal system. The pandemic spurred lots of changes at the federal level. The feds implemented several new unemployment programs, and at the state level. So these changes to the state's unemployment computer system during the pandemic, plus the surge in unemployment claims, created system errors and processing delays. States with more modern unemployment computer systems appeared better equipped to handle the challenges of the pandemic. At the time of our work, it was about half and half. I think 26 states had modernized systems, and the other states were a little more archaic, like Kansas system. We also looked at staffing and call center issues. Prior to the pandemic, Department of Labor had few staff to answer calls because of historic low unemployment rates in Kansas. Federal funding for call center staff is related to unemployment levels, so we were low, so we had low staff. Despite adding additional staff during the pandemic, the number of calls answered did not improve significantly. And finally, we issued an unemployment fraud estimate. Back in part one of the audit, we had estimated about 600 million unemployment fraud. For this audit, for part two, that was a high-level rough estimate. For part two of this audit, we used an advanced computer model and neural networking to more precisely estimate unemployment fraud. We used some machine learning and reviewed all 100 million claims filed from January 2020 to February 2021, and we looked for 26 different fraud indicators. At the time of our report, again, back in August, we revised our initial estimate, and we estimate about 700 million in potentially fraudulent payments could have been made in Kansas during the pandemic. And that's a combination of these claims that we identified and unemployment fraud claims that the Department of Labor had identified as well. About half of that amount, about half of the 700 million, is federal funds, and the other half is state funds. However, giving some credit to Department of Labor, we estimate about $2 billion in potentially fraudulent payments were prevented by the Department of Labor. They were stopped either by KDOL fraud staff, reported by the public, or deemed ineligible for payment. Department of Labor at the time reported working with federal organizations and banks to identify and recover those fraudulent payments, but no estimate on recovered funds was available. Turning the page, the next audit, again, was one of those small, limited scope audits that is only 100 hours. And this was looking into, there were concerns about some grants that local election officials had received. So this audit was about the Center for Tech and Civic Life. It's called CTCL. It's a nonprofit organization that provides civic information for voters. In 2020, CTCL made election grants available to local election offices across the nation. 49 states participated in those grants. In Kansas, 25 counties applied for the grant and were awarded $2.3 million. The grants ranged from $5,000 to $856,000 per county. There were no obligations associated with the acceptance of these grants. Counties reported using the grant money on items such as election equipment, staffing, renting facilities with space for social distancing, disinfecting cleaners, that sort of thing. And as of July, though, however, counties will not be able to accept these types of grants in the future because of legislation that you all passed. Next, moving on, evaluating mental health and substance abuse initiatives to improve outcomes. This was an audit. There were concerns about whether what Kansas is doing, is it effective? We found that several state agencies oversee state-funded substance abuse and mental health treatment in Kansas. For example, KDHE oversees Medicaid, KDADS oversees federal substance abuse and mental health block grants. The Sentencing Commission is involved in Senate Bill 123, and Corrections oversees state-funded programs for prisoners and parolees. State-funded substance abuse and mental health treatment in Kansas is provided through a network of approved treatment providers. We interviewed 23 different substance abuse and mental health providers, and they reported using 95 different practices and programs to address their clients' needs. Obviously, there is not one size fits all for mental health and substance abuse, but common things that they mentioned were cognitive behavioral therapy, motivational interviewing, and strength-based models. Kansas substance abuse and mental health providers used similar practices in providers in the other states we reviewed. We looked at the 11 most common practices to see if there was evidentiary basis or substantial support showing effectiveness. Of those 11 most common practices, 8 had moderate to strong support showing effectiveness, and 3 practices had either weak evidence of effectiveness or inconclusive results. Many providers reported a lack of funding and staff shortages hindered their ability to provide mental health and substance abuse services. Unfortunately, a lack of reliable outcome data and other broad problems kept us from determining the effectiveness of mental health and substance abuse treatment in Kansas. Determining success is very subjective, and some conditions are lifelong. Persons seeking mental health and substance abuse treatment also tend to be more transient. Moving on to one of our economic development evaluations. In 2021, we audited the STAR bonds financing program. In case you're not aware, STAR bonds allow local governments to use future sales tax revenue for development or redevelopment projects. STAR bonds can help pay for property acquisition, site preparation, and infrastructure costs. The Department of Revenue uses part of the state and local sales tax revenue generated from the businesses in the STAR bond district to repay the bonds. As of November 2020, about $873 million in mostly state sales tax revenue has gone towards retiring $1.1 billion in STAR bonds. We used 2 separate analyses to estimate STAR bonds' economic and fiscal impact. We focused on tourism, and then we did what's called a break-even analysis. Tourism is a key component of the STAR bonds program, and Commerce has established 2 tourism goals for STAR bonds projects. Those are that 20% of the visitors must come from out of state, and that 30% of the visitors must come from at least 100 miles away. Commerce had no data to analyze these factors. So to determine whether 16 STAR bond attractions met those goals, we reviewed data that estimates visitation using cell phone and vehicle GPS location data. The 16 attractions we reviewed drew very different numbers of visitors, and only 3 of the 16 met Commerce's 2 tourism goals that I just mentioned. The other STAR bonds attractions likely provided many local benefits, but that didn't satisfy the program's unique purpose of stimulating the Kansas economy through tourism. We also reviewed 3 STAR bond districts to estimate how long it would take the state to recoup the sales tax revenue it gave up supporting the project. We call this the break-even analysis. And there's a lot of methodology to this, but we estimate it will take decades for out-of-state visitor revenue, sales tax, to make up for the tax revenue the state gave up for the 3 districts we reviewed, which were the Hutchinson Salt Museum, the Prairie Fire Museum, and the Wichita Sports Forum. For these 3 projects, using STAR bonds shifted significant private and local government costs to the state. In the interest of time, I'm going to skip over the Butler County Community College limited scope audit unless I have a particular question. I'll move on to foster care. We've done a number of foster care audits over the years. This one was focused on the case plan tasks, and that is basically what the parents have to do in order to either reunite with their children or achieve some other outcome. So while in foster care, children have case plans that document their permanency goals and what they or others must do to achieve those goals. A case management team develops and monitors the case plan. Overall, we found that parents' tasks for reunifying with their child were generally reasonable and relevant to the case issues, and parents generally made decent progress or completed those tasks. So to do this, we reviewed 48 cases in depth, and in those cases, the parents had 11 tasks on average, and they were mostly related to why the child was removed or other safety risks. And these tasks included things such as the parent submitting to drug tests or maintaining stable housing or attending parenting classes. In those 48 cases, about 90% of the tasks we reviewed were reasonable and relevant to the child's case, or to the children's reunification. However, about 10% of the tasks seemed unreasonable or irrelevant. For example, a parent was asked to submit to drug testing, but the case had no indication of substance abuse or drugs being a problem. We found that parents often completed or made progress on their assigned tasks. They don't have to complete every single task in order to reunify with their child. Case managers told us parents can finish some tasks, such as parenting classes or therapy, after they've reunited with their child. Finally, legislators had expressed interest in knowing whether children's foster care outcomes varied based on things like race or age. And outcomes are you reunified? Are you adopted? Are you emancipated? Those are considered outcomes. So we did a regression analysis on the foster care children to the best we could to isolate race issues, age, sex of the child, that sort of thing. So what we found is Black children and Hispanic children had outcomes that were generally similar to white children, but our regression analysis showed that both groups had significantly different outcomes, such as reunifying with parents. And Black children were overrepresented in the foster care system among children still in foster care. American Indian children were less likely to reunify with their parents and more likely to transfer to another agency. And no other notable differences were in other races we reviewed. Older children the older the child was when the child was removed from their home, the less likely the child was to reunify or to be adopted. And finally, we found that female children had similar outcomes to male foster children. Moving on to the comparing COVID-19 death rates. Again, this was a small limited scope audit. This was a quick look to determine, I believe we analyzed September to December 2019, and we compared that to September to December 2020, looking at the causes of death for Kansans. The concern was that no one was dying of the flu anymore, everything was coded as COVID. What we found was determining and recording the cause of death involves funeral home directors, local medical certifiers, the Kansas Department of Health and Environment, and the National Center for Health Statistics. The medical certifier, who is the coroner or doctor in attendance, is responsible for inputting medical information into the system, including cause of death. And when we analyzed September to December of 2019 and 2020, the leading causes of death were pretty much identical, except for the additional deaths due to COVID. So in 2019, the leading causes, for example, heart disease, cancer, going down the list, top 10, we came to flu. In 2020, it was those same conditions in the same order, except they all moved down a slot. and COVID was the #1 cause. Next, we have an audit looking at distributions from the healthcare provider. We call it the healthcare provider tax. It's the Healthcare Access Improvement Program. So the legislature created this Healthcare Access Improvement Program in 2004 to increase the state's Medicaid reimbursement rates for healthcare providers. How it works is HCAP requires most Kansas hospitals to pay an annual tax based on their operating revenue, and then KDHE combines that tax revenue with federal matching funds and pays out increased reimbursement rates to healthcare providers. Those rates were set in 2006 and have not been changed. So the question here was, what are the rate increases, which conditions are paid more, and that sort of thing. State statute requires HCAP revenues to be dispersed in a specific way to hospitals and non-hospital providers, and statute requires that the program be state general fund neutral. In 2020, we found that HCAP did not comply with the 2 provisions in state law related to distributions. Further, the program did spend federal funds, approximately $12 million. The way statute is written, though, it makes it very difficult for KDHE to precisely monitor whether the program complies with state law. And that's also because of managed care and Medicaid. It's sort of written on a fee-for-service type situation, but with managed care, everything is sort of rolled into one. So we found it's unlikely that KDHE can ensure compliance without changes to the program, and they are trying to make those changes, but some of those require CMS approval. At the time of our work, they were still waiting to hear from CMS. Finally, looking at an audit, we had looking at county government. It was whether they have procurement practices and policies to address conflicts of interest. County governments purchase a variety of goods and services in many ways. Individuals who participate in the purchasing process should avoid conflicts of interest. For example, it would be a conflict of interest for a county employee to participate in the selection of a contractor when a family member owned one of the companies that was bidding. State law requires counties to address conflicts of interest, and best practices suggest ways counties can identify and manage. However, in general, counties must rely on the honesty of their employees to detect most conflicts. We looked at a sample of counties. The larger counties we evaluated typically had policies that addressed state law and best practices relating to identifying conflicts of interest, but the smaller counties did not. I mentioned we had done part 1 of that Department of Labor audit. I will skip over that in the interest of time, because then we issued a part 2 with an updated estimate. So that is it. We have a number of audits coming up. We have a full slate here. We are going to be doing another audit on foster care. It's currently wrapping up, looking at safety. We have an audit coming up looking at COVID relief funding distribution. And that's going to be looking at what is the process and have the distributions been appropriate. We're going to be releasing an audit soon on implementation of the performance-based budgeting process that was implemented in 2016. Our agency's doing what they're supposed to do, basically. We're going to be looking at the availability, cost, and quality of centralized IT services across state agencies. We're looking at the accuracy of certain economic impact statements. State law requires that all changes to administrative regulations have an economic impact statement prepared, so we're looking at those. We are wrapping up an audit looking at developmental education courses. Those are remedial ed. This was a limited scope audit, so just a quick audit, and it was what do stakeholders say about why so many students need remedial courses in college. We have another small one looking at trends in social workers employed by school districts, just the number and what their salaries are. We have 2 limited scope audits related to suspension and revocation of Kansas driver's license, both the financial impact and the impact on Kansans, such as ability to pay the fees, ability to get to work, that sort of thing. And finally, the next economic development incentive evaluation we're getting ready to release has to do with industrial revenue bond property tax exemptions. With that, Mr. Chair, I'm happy to answer any questions. I will put a plug in. All of these are available on our website. We also issue podcasts for every audit we do. Lots of legislators enjoy listening to those. And I'm happy to answer questions as best I can.
Thank you, Chris. I guess one that I have, on the Department of Labor and the computer system, you mentioned there was like 26 other states that had antiquated computer systems, and I know Colorado has one very, very similar to Kansas, and yet they didn't have the $700 million worth of fraud. Were we just late in getting the patches put in, or did you analyze what went wrong?
We analyzed the fact that it was a contributing factor, mostly to the delays in processing claims. It really slowed things down. The feds were implementing new programs like PUA quickly, and we were trying to cobble those things together with this antiquated system. So that mostly led to one of the questions we were looking at is the delays, why it was taking so long for Kansans to get their claims processed. As far as the impact on fraud, I'm a little unclear as to whether the actual system had an impact on the fraud.
Because I know early on, I was getting phone calls from businesses in my community, and they said, listen, I've got employees here, been here 30 years. They're still here. Someone's filing a claim on them, and we'd call and tell them, hey, these are fraudulent claims. You would think the red flags, it was numerous times that they were warned that these issues were happening, and it just seems like we really failed there somewhere terribly wrong. And, it's like even when we added staff, still couldn't answer the phones. What did you figure out on the phone deal? That, to me, was, you had all these people and nobody's answering the phone.
Right. They, at the time of our work, the indication was they had cobbled staff from other state agencies. They had reassigned Accenture staff, all to answer the phones in the phone center. But I believe, I'll have to check in the report, but they were getting like 12 million calls or something, and 50, 100, 300 people just can't handle that amount. So it really didn't make a dent in the number of calls answered. And I think people were calling and calling and calling repeatedly because they couldn't get through.
I think that's exactly right. There was, people would call and say, I've been calling all day long,
Right.
So, yeah, thank you. Other questions? Senator McGinn.
Thank you, Mr. Chair. My question is going to be on star bonds, but just a quick question on these death rates. And I thought I heard you say everything, went down the line with whether it was cancer, heart attack, et cetera. And then I heard you say the flu, but I guess indications I heard is that the flu was actually less during that period of time when people were staying home or masking up or something like that. So
yeah, the actual numbers from year to year did vary, but the ranking stayed the same-ish, and the numbers were pretty close.
Thank you. On the star bonds issue, I don't know if there's any bills out there to streamline it, but I remember like one of our first star bonds, and it was revitalizing the Keeper, which is a downtown destination area for people to see. And then I see that they are looking at call it the sports, the one in Wichita, the Wichita Sports Forum. Mm-hmm. And then recently, at least my cursory reading on what's going on at that facility, it's far exceeded so the golf thing, I don't know what it's called, Top Golf or something. And it has exceeded, in my opinion, what they were intended to do, where now they're building restaurants and maybe hotels and other things. So they're competing. I mean, they're getting a break from those folks outside of the Star Bonds area. And so I didn't know if you investigated any of that, and that, of course, was in the paper probably about, I don't know, 5-6 months ago, COVID time, I'm not sure. So did any of that come up, that the areas are being abused for what the intended purposes were of the Star Bonds, which is to bring in outside tourists, which the definition of that would be anybody that lives outside of Wichita?
I will check with my team as to whether that particular issue came up, but there was some discussion recently about, and I'll check with my team about this too, but there's an initial Star Bond district that gets approved, but then things can be added or the district lines can be changed, but I'm not 100% sure on that. So I will check with my team and see if they have any information on that regard.
I was around when these began at local level, and it just seems to me like the intended purposes of a Star Bonds has totally expanded to a lot of other things. Thank you. And so the other question was, I was looking on the website, do you know of any bills out there? I mean, generally we have a Star Bonds bill every year, but is there anything out there that's
I don't know off the top of my
address
head.
these issues?
I don't know. No, not off the top of my head.
Okay, thank you. Thank you, Mr. Chair.
Senator Alley.
Thank you, Mr. Chair. This is also on the Star Bonds. I thought there were clawback provisions in that. Are there any clawback provisions in the Star Bonds?
I will have to check. All of the Star Bonds have a 20-year repayment plan. I believe all of the projects are on track. There is one that is a bit questionable, possibly. So I'm not sure what we would be clawing back.
Would look that up. Thank you.
Yes.
Senator Salntrop.
Thank you, Mr. Chairman. On the death rates due to COVID,
Yes.
was that increase attributable to COVID only, or was COVID the last known element that contributed to death? What kind of comorbidity analysis was there?
Yes. We looked at September 1 through December 31, I think, for 1 year compared to the next year, those same timeframes. We looked at the leading cause of death, which is a specific indicator on a death certificate, and just compiled them for 2 years and compared them. And they were very similar. COVID took over the #1 spot in 2020, but the remaining rankings remained relative and the numbers remained similar.
If I may.
But yes, there are comorbidities and it does get complicated. We just focused on what's considered the leading cause of death, as indicated by the medical professional at the time of death.
If I may, Mr. Chairman, is there, and you hear these behind-the-scenes stories about financial assistance or anything like that to identify a death related to a cause? Was there anything like that even remotely associated with identifying the determination of death?
No, we went with what was recorded on the death certificate by the medical certifier.
Thank you.
I have one additional question. You said that the department uses the part of the state and local sales tax to reduce the bonding. What percentage? I mean, is there a certain percent of every dollar that goes to reduce this bond? Do you know what that percentage is?
I will check, but I believe my understanding is the entirety of the sales taxes are used to repay the bond.
That's why I wondered, because you, in your deal here, it said use as part. That's why I was wondering what part, you know.
I will check that.
Okay, and then, do you know how many of these have been paid off? I knew the one in Kansas City had, that's why I wondered if there was any others. Is there, do you know?
Not off the top of my
I'm
head.
just curious. Any other questions? Senator Petty.
And it was paid off in 17 years instead of 20.
Right, that's been a very successful one.
Yes,
I
for sure.
disagree.
Yes.
Okay, well, Chris, thank you a lot, appreciate it.
You're welcome. Thank you, Seth.
Next item we have is a briefing on the Special Committee on Home and Community-Based Service Intellectually and Developmental Disabled Waiver, and we'll have Matthew Moore, Legislative Research Department, and happy birthday, Matthew. Today's his birthday.
Someone is going to get a stern talking to. I appreciate it. Thank you, Mr. Chair. My name is Matthew Moore, with Fiscal Analyst with Legislative Research. Just wanted to provide a brief overview over the Special Committee on Home and Community-Based Services Intellectual Developmental Disability Waiver. We met over the interim in October over 2 days. You should have the reports before you. I'm really just going to touch upon the first 2 pages, page 3 and 4, with the recommendations. The committee heard testimony from the agencies on eligibility for the waiver. We heard testimony on the wait list from the agencies, some stakeholder organizations, as well as individuals with families with individuals on the wait list. We heard from providers about the workforce shortages that they are facing, and then we heard some testimony from the agencies regarding funding and reimbursement for the waiver. On the final day, we made a total of 10 recommendations. I don't want to go over each one in depth, but overall, they sort of fell into 3 broad categories: further study of the waiver, additional funding for the waiver, and some changes in the structure of the waiver. With respect to kind of further study of the waiver, I'd just like to highlight that very first recommendation that the agency made, which was for the LCC to consider approval of a committee or a task force that's similar in structure to the Mental Health Modernization Committee that's met over the last 2 interims, complete kind of with the working groups, to sort of study modernization of the IDD waiver. The next sort of study recommendation that was made is number 4 there at the bottom on that gray box, for KDADs to kind of conduct an analysis of a specific category rate for targeted case management and kind of compare that with other programs at other agencies to see kind of whether or not those are the same, whether or not they need to be increased. The final sort of study recommendation I'd like to bring your attention to is on page 3, the second from the bottom, that KDADs with KDHE sort of collect and provide some information of the needs of individuals on the wait list, as well as separately needs of individuals on the waiver itself. There was some testimony at during the committee that individuals are assessed when they're put onto the waiver, on the wait list, and then they might not be reassessed until they get onto the waiver and start receiving services. And that time between being put onto the wait list and onto the waiver can be several years. And so the committee indicated to the agencies that it would like to see some sort of a reassessment of individuals to help kind of give an idea of what the current level of need for those people waiting for services are, and then additionally to kind of do the same look at individuals on the waiver itself. The second sort of group I'd like to talk about are funding. There was some general recommendations on looking at specific services on the waiver and have KDADs look to see what those rates are, whether or not they might need to be increased, and provide sort of recommendations to the House Social Services budget and the Senate Ways and Means Subcommittee on Human Services, provide some recommendations for them as to what those rates could be increased to. The next one was for there to be just sort of the legislature approved general funding for the IDD waiver, kind of as a means to then provide some funding for salary increases for direct support employees. And then additionally, that the legislature sort of identify areas in the budget that expenditures could be reduced to allow for additional funding for the IDD waiver. The final sort of group of recommendations I'd like to touch upon are sort of kind of the structure and waiver authority for the IDD waiver itself. The waiver is considered a comprehensive waiver, which means that if you are eligible for the waiver, you're eligible for all services on the waiver. And throughout the committee, there was some testimony of other states and whether or not kind of the way that they've structured their waivers might help reduce the wait list, and whether or not there's another sort of kind of federal authority that we could look into to sort of, rather than it be a comprehensive waiver, if we could have a waiver that sort of met individuals' needs. The next recommendation is that last one on page 3, that the legislature consider providing individual budget authority to participants who self-direct their services. We'd heard some testimony that individuals have the option to, rather than have an organization sort of hire their personal care attendants and individuals providing services, to take that duty upon themselves. And there were some proponents that believed that if those individuals had kind of their own budget authority to kind of take that pool of money that they receive, they might be able to kind of fit their needs a little bit closer. And then the final recommendation I'd like to touch upon is that last one on page 4, that the legislature explore potential legislation to provide automatic annual adjustments for the IDD waiver reimbursement rates. And that was a topic that was sort of identified as being one that if the LCC approved a kind of a special committee to review modernization of the waiver, that this could be a topic that committee could look into. The rest of the report just is a couple pages, just providing an overview of what was presented, some of the providers who testified, but I won't go into that. I would stand for any questions.
Thank you, Matthew. Committee, one thing that I'd like to point out on page 5 is there are 9,107 individuals that have been identified by the IDD community. The wait list is 4,563. So that was one of the focuses for the committee that, you know, we need to do better. It takes 9.5 years to get off the wait list. And we discussed maybe some things to look into as far as, like Matthew mentioned earlier, that the assessment, that we maybe do this assessment, look at it more often. There may be some individuals there that could be helped that maybe only need 1 or 2 services or something not quite as immense as the full service package. And we suggested maybe that we look into that. And one other thing that I want to point out, there was a young mother there that has a child that's needing the services, and there's a lid on how much these folks can make. And if you make too much money, they get kicked off of the insurance. And this young gal told us about she's living in her parents' basement because she can't make enough to provide for her child and still pay the health insurance and everything else. So she has to stay under a certain amount. So I think that's another issue that we thought would be important to look at, because to hold somebody down just because, you know, they need the services really doesn't make a lot of sense, so. Other questions? Well, Matthew, happy birthday and thank you. Appreciate it.
Thank you again.
Committee, couple of notes. Subcommittees, we're going to start meetings on January 31st, so not too far down the road here. And Nancy's got some handouts, the subcommittee members and the spreadsheet, so she'll pass those out. And Nancy is going to be working on the scheduling, on the hearings and deliberations, and so as soon as she gets the different ones lined up, she'll share that with everyone. Anyone have any questions or anything? It's everybody's on the same that they were last year, so we didn't change any, and everything's same. Yes. Well, if there's no questions, committee, thank you, and we are adjourned.
You mentioned that the other agency budgets will be heard in the standing committees. Will that start the 31st as well?
Planning on it, yes. We're just, as soon as they get us the information we need to get started. And that's the projection, so thank you. With that, we're adjourned.